And good evening, everyone. This is John from Partners in Health, Sierra Leone. Today is Tuesday, April 14th. One new coronavirus case was confirmed in Sierra Leone today, bringing the total number of cases up to 11 in the country. The new case was a traveler from Guinea who had come over and had been in quarantine for a couple of weeks. Today we're joined by Allie Pearson, Partners in Health Sierra Leone's supply chain manager. And Allie's going to give us a little bit more insight into the impact that coronavirus has had on global supply chains and the availability of personal protective equipment to keep clinicians safe, medical supplies and pharmaceuticals, and also steps we've taken as an organization to prepare ourselves for an eventual outbreak in Sierra Leone. Just going to jump right in with some supply chain questions, if you don't mind. So there's a lot of concern around the world right now about shortages of medical supplies and equipment needed to fight coronavirus, masks and other PPE in particular. So where does Sierra Leone stand with all of those equipment needs, and do Wellbody Clinic and Koidu Government Hospital have enough stock?
For now, we're doing okay. The thing that's a bit scary is that we don't know the level of impact that our facilities will have, and so we don't know how much consumption we will have down the line and how many months that will last for. So we do have some estimates from Marta about our projected monthly demand if we get significant cases of COVID in Kono, and we are placing orders to be able to support that demand. But for now, we're great. We have a pretty good stock of N95 masks left over from Ebola, and we have face shields, reusable and disposable. We have now a lot of gloves that Uratu and the team and the procurement team in Freetown helped us to secure local order of gloves, because the international supply chain for gloves is not very. There's shortages globally. So we're okay for now. The thing that's worrying is that we don't know what our demand will look like. So we are trying to conserve what we have for now just to be safe. But we are also placing orders for if we potentially have a lot of COVID cases in Kono in the future.
Can you talk a little bit about sort of when you heard about coronavirus and sort of how we started preparing in terms of the supply chain? Any steps? I think you started to answer this, but any steps you took to make sure we would have what we needed?
Yeah, sure. So the first thing we did was to place orders of things before we were even thinking that coronavirus would be coming to Sierra Leone. We placed some cross-site PIH orders for things that we thought that the lead time would be dramatically impacted for even just our normal care. So we fortunately had some orders already in for things like surgical gloves, surgical masks, gowns, exam gloves, N95 masks that have been in the pipeline for over a month now. So that has really helped us with the lead time issues that have been coming up more and more. But then the next thing we did was to look at if and when we were going to be having coronavirus in Sierra Leone, what would that mean for increased demand? Which items would we need more of? And would we be able to support that increased demand with what we currently have? So we've now placed a few different orders for cross-site PIH with quantities for a lot of these IPC materials, and then also drugs, equipment, other things that are needed for COVID.
For most of the severe cases of COVID, they require like ventilators and other pieces of equipment that don't necessarily exist in Sierra Leone. Can you talk a little bit about whether we've been a part of procuring any of this equipment or what our stock levels are for it?
Yes, so the government of Sierra Leone has purchased a lot of ventilators for the country. We have bought new 10 liter per minute oxygen concentrators, which are going to be useful even without coronavirus, but it was with coronavirus funding, and it will help for a lot if we are treating COVID at our facilities to have these extra concentrators. For ventilators, there's still a question up in the air because the aerosolization of the way that when you use a ventilator, it puts a lot of particles into the air. I'm not a clinician, but this is my understanding. So it puts those around the person being ventilated at greater risk of contracting coronavirus. And it's also quite a specialized piece of equipment to use. So our team is, we have people who are trained to use ventilators, and we want ventilators for our facility even without coronavirus. But the question of whether we're going to use them with coronavirus patients still sounds like it's up in the air because of the risk it would put our providers in to use them.
Yeah, and I know we also just sent over 2 new oxygen concentrators over to the military hospital. I think they're on loan from Partners in Health to the military hospital because they're actually seeing coronavirus cases. So I think there were 4 that came in, and 2 are now, 2 are for LACA for the TB hospital, and 2 are for the military hospital.
Yes, and that was just the first 4 of an order of 20. So there are more coming in for Sierra Leone.
And are there any examples of where things are worrying you, whether it's for the KISI Psychiatric Teaching Hospital order or our KGH order, Wellbody?
Yes, worried all around, mostly because of the uncertainty. So with the reduction in flights coming into Sierra Leone, there's now very few options for air shipments, which even just generally for our normal use, we haven't seen any options for shipping cold chain, which is very worrying because we have a lot of lab reagents that require cold chain. Also, insulin is cold chain, and if we're not able to bring in cold chain shipments, that will impact our ability to provide care to patients. But also just the uncertainty around shipping. Sea shipping seems to be not impacted in terms of timelines, but the costs have gone up. We are expecting that customs clearance in country will not be impacted too much, but we have yet to prove that. So hopefully we're right about that. But yeah, air shipments, the cost has gone up significantly, and also the only provider bringing air freight into Sierra Leone is DHL. So the options are very limited, and some of our suppliers are not used to using DHL. So we're working with them on how to make that, how to figure out the DHL system with them, especially for human reagents. Right now, there's a shipment of human reagents, which is the biochemistry analyzer that have been ready to ship to LACA for almost 3.5 weeks now, and there have been no freight options. It's a keep cool shipment, and even with DHL, the timeline is they can't guarantee that it would arrive in the right amount of time, so they're not shipping that to us, and they're holding it. So we're working with them on finding a solution, but that's definitely been stressful.
And what about the ordering system for our general supplies? So obviously this impacts all of that as well, but have we moved forward with kind of the standard orders that we would require, or have you changed any of the approach to our supply chain?
Yes, we've moved forward. We are paying a lot of attention to lead times, and some of our suppliers are tend to be more accurate with their lead times. So we are putting weight on those suppliers, especially the ones that have things available to ship soon. We're trying to ship as much by sea as possible, so reducing the number of suppliers and even if the cost for one particular item is higher from one place, we know that from one supplier, we know that the cost of air shipping and the availability of air shipments has gone up so much that it's in our best interest to try to consolidate with fewer suppliers and ship by sea. So that's all being taken into account, but we have moved forward with the normal bulk orders, and a lot of things are not delayed. There are, however, some quite essential items that have been delayed. Gloves, surgical masks, gowns, all of those supplies are having no confirmed lead time because of delays globally with shortages and high demand. But for those things, we are okay in the short term. What we're worried about is the medium and long term if we're not able to replenish our stock.
And when when you say the short term, how long are you thinking we have a buffer?
Well, line by line, it's a bit different, but like gloves were okay for the next 6-7 months. Gowns, I think, the type that we'd prefer, we only have maybe 3 months remaining, but we do have a lot of other gowns that we can use as a substitute if we need to, like for surgery. They're just not the preferred option. So, there's so many formulary lines that we're managing, so it's a bit different, line by line. But
how many formulary lines are we managing?
Let's see. We have
a lot of clicking over there. Sorry to throw a question at you.
650 items.
Is that, for our staff who are listening, is that a lot? It sounds like an enormous number of supplies to me, but compared to hospitals in Philadelphia, for instance, is that a lot of supplies? And how do we come up with that?
So we try to consolidate to fewer. So in a hospital in Philadelphia, they would have, every different brand of suture for different preference for surgeons, and they would have lots of different types of exam gloves, nitrile, latex, powder-free, powdered, and we try to consolidate to just as few items, as few SKUs as possible, stock keeping units, for a number of reasons, but we try to find the best value for money for things like gloves, and by all of the quantity, and the cheapest type of exam glove is latex, and we can, if we were to split between nitrile and latex, that would impact our budget and impact the amount that we can do. So we're trying to stretch, and so one of the ways we can do that, and one of the ways we can keep our stock levels good and simplify our formulary is to try to keep that number not too high.
Yeah. And you've been a part of supply chain responses to lots of different emergencies since you started at PIH. How does this compare from a supply chain perspective, the coronavirus outbreak, to Ebola or cholera?
This is very different because of the global nature. During the Ebola outbreak, the region that was impacted was West Africa, and so the rest of the world was still operating normally, and there were shortages for Ebola-related items, but it wasn't as significant or as widespread. And the focus of the Ebola response, the whole world was coming to help West Africa and help make sure that all of the supplies were getting to Sierra Leone and Liberia and Guinea. And in this case, everybody's having the same shortages, and the shipments and everything are impacted not just in the region but globally. So, like for example, in the U.S. and the EU, they've restricted exports of the very things that we are also in need of in Sierra Leone. So we are able to still export things from the U.S. Because there's a clause that that means that humanitarian related shipments are allowed to leave the U.S. But the EU, until it was last week, I think, when they eased the restriction, but it impacted some of our shipments from the EU. Our normal bulk order shipments, they had to pull out the gowns and surgical masks because the EU was having shortages of those things, and so they put export restrictions in place. So, yeah, that's definitely different than in past emergencies that were a little bit more localized.
I mean, I know there's a lot concerning the supply chain right now, and we're all really worried about what happens if there are more confirmed cases in Sierra Leone and in the region in general. But what, if anything, are you optimistic about, is keeping you motivated during this moment?
Yeah, I mean, I'm feeling hopeful that we have a pretty good stock of things left over from Ebola. So like N95 masks that are now really hard to find internationally. We're okay for the next 6 months or so, which gives us a really, a comfortable buffer that we, we don't have to worry about air shipments, and we don't have to worry that the lead time is 4 to 5 months. That's actually okay for us. So that's, also reassured that Marta is, so on top of, figuring out quantities that we need and what we need. And so I feel like we are in very capable, competent hands in terms of planning for what we might need in Kono.
And how is
Kisi and Laka.
And how is the supply chain team doing right now in Sierra Leone? How are they feeling?
Yeah, well, I think really good. Uratu and Teddy and Kareem and Princess and Aliu, and they've all been, helping us in all the different areas to, check what we have, check all of our quantities at the warehouse, and, keep the facilities stocked and place, urgent orders in Freetown. So, yeah, the team has been helping a lot to support our response already.
Thank you so much, Allie, for taking time. I know everyone's going to love to hear from you, and thanks for all you're doing to make sure we have what we need to respond to this.
Thanks, Johnny.
Thanks, everyone, for listening. Tomorrow, I'll be back with Isata Dumbuya to hear a little bit about the impact that coronavirus is having on maternal health services in Kono District.